Hello, Three West nurses. This is Nathan Hostler, your SWAT nurse, and today I want to talk to you a little bit about how to assess if your patient is appropriate or safe to go down for an MRI. The objective of this lesson is to help increase your confidence in your ability to assess if your patient is appropriate or safe to go down for an MRI. So first we'll look at why it's important to know how to assess your patient and how to know if they're appropriate to go down for an MRI. Then we'll look at what your patient is actually going to be going through in an MRI so you have context to your assessment. We'll then discuss and look at some helpful assessment questions that you can ask your patient and ask yourself to see if your patient's safe to go down. Then we'll look at some helpful tips on how to talk with your ordering provider if you have any concerns, and then maybe some recommendations you can share with them. And lastly, we'll just take a quick look at an MRI appropriateness tool that I've created to help you quickly decide or do a quick assessment for your patient. So the first thing I want you to see is why it's important to be able to assess your patient if they're safe to go down for an MRI. First thing to know is that MRIs are difficult to accomplish. They're difficult to endure. They're strenuous exams, and we'll go over and look at why they are, but they definitely have the potential to push an already sick, acutely ill patient into becoming unstable. And so patient safety is first and foremost, and being able to assess them before sending them down can really help avoid any unsafe situations that the patient otherwise could be put in. And then the last couple of things we see is that failed exams, when patients get sit down who are inappropriate, end up wasting the patient's time, end up wasting your time, the MRI department's time, and then it can push back all the other waiting patients that need to get an MRI, which is already a difficult process because they get backed up so easily, and it includes your inpatients. So being able to assess if your patient is right for an MRI, if they're safe at that moment, first and foremost keeps your patient safe, and then it also helps to save the patient and the hospital time and money. To get a better idea of why it's important to assess your patient and how to assess them, let's go over really quickly on what your patient is going to be going through when they get an MRI. Not all of us have been down to an MRI or had one ourselves. And so I wanted to give you just a kind of quick rundown of what they have to go through. First, patients must be able to lay completely flat on their backs. And a lot of times that's for a prolonged period of time. That can be 2+ hours in many cases. Next, patients, the MRI tables are hard. They have a mat down and we try to support their knees, but they're hard tables. Next, the patients, when they go into the MRI machine, go into a pretty narrow bore. And so for that 1 to 2 hours on their backs, they're going to be in a confined space. That's a pretty tight squeeze. And then lastly, patients have to be able to lie still. And so they need to be able to follow directions and be redirected. MRIs are much like photographs. If you're moving during it, the pictures come out blurry. And so when patients are moving and they're not able to follow instructions and to lay still, the pictures don't come out, and it's undiagnostic. And so your patient has to be able to lay flat in an enclosed area for a prolonged period of time in order to get a good exam. So here is the bread and butter of the assessment portion. I've listed out some possible questions for you to have in your mind and to also discuss with your patient to be able to see if they are going to be able to do the things that we discussed just a minute ago. So first, can your patient lay flat? That's really one of the most important and simplest. It's the simplest question and most important that you can ask. And you can test it Lay your patients down, lay them flat in their own bed up on the unit for 10 minutes or so and see how they do. If they become short of breath, if their sats go down, their heart goes up, heart rate goes up, if their work of breathing goes up, you know that that patient can't go down for an MRI at that moment. Lying flat is not an option for them. Therefore, an MRI is not until we can get that resolved. Next, ask your patient, are you claustrophobic? If so, we'll look at some things to help them that we can help them with, but it's important to know that so that we can utilize some medications or something prior to them going down. Is your patient acutely confused? Are they agitated? Are they combative? If they're not going to be able to lay still and they're fighting and they're moving and they're not listening to instructions, then those pictures are not going to be able to come out and it won't be safe to put a patient like that into an MRI. Lastly, I think a really important question you can ask your patient is, have you attempted an MRI before and how did it go? If they've had problems in the past and they have not been able to accomplish one, it's important to know that, to see is there something we can do to remedy that. Or if they've had problems in the past and doctors utilized some medications or something like that to help them get through, then that would help us right off the bat. So that's an important thing to look at. So on the right-hand side, I just listed out some of the patients that might be potential trouble patients for you. That list isn't exhaustive, but it's a helpful start. If your patients happen to deal with things like heart failure or acute respiratory failure, then they might be the ones that can't accomplish an MRI right at that moment, or at least the ones who you need to look closer at and assess before you send them down. So now that you've done your assessment, utilize those assessment questions that we went over to then discuss with your ordering provider if you have some concerns. For example, you can lay your patient flat in bed before they go down up on the unit, and if they become short of breath after a couple minutes, or their sats drop, or they start complaining that they feel like they can't breathe, right there is something that then you have to go and talk to your provider about that is a tangible concern. Or if you talk with your patient and they let you know, I failed an MRI in the past, I get too claustrophobic or too anxious, or maybe they successfully completed one, but it was only after they got some medicine to help them calm down. That's all stuff that's really important that can be conveyed to your provider that we can get a hold of and we can fix before sending them down to an MRI. So some other helpful recommendations is once you find those concerns, ask your MD to come up to the bedside and take a look at them themselves with those concerns in mind. Maybe you can suggest an alternative exam. That's not always possible, but a lot of times it is. If they can't lay down flat for a long period of time, maybe they can lay flat for 5 minutes. Then we can do a CT scan, or maybe they can get an ultrasound scan. You can also, if your patient says, like we discussed before, the example of a patient who said they needed some medications in the past because of their pain or because of their anxiety or claustrophobia, then share that and get those things on board, like IV pain medicine or oral Ativan or something like that, that we can get going and help get them relaxed before we send them down. Um, all those things will help ensure the safety of your patient. It'll help to either avoid an unsafe situation by not sending them down, or it'll help prepare them so that we can have a successful, safe exam. Last but not least, anesthesia is a great resource for extreme cases that we use all the time. If a patient is completely unstable when laying flat, or they say they have to be completely knocked out to get an MRI, then have your doctor talk with them about anesthesia. That way, it is in extreme cases, but that way they can be assessed and they can be taken care of and they can get through that exam safely with the anesthesia team. Lastly, here is a quick tool for you to use. I'll be posting it in our lounge. It's just going over those same things we went over in a really quick format. So if you're going in to see them, those are the four main areas. If your patient's short of breath when they lay flat, are they claustrophobic? Are they dealing with severe pain? Or are they currently confused or agitated? If the answer to any of those is yes, then just stop, talk with your doctor, have them come up and assess the patient, and maybe go over some of the recommendations that we talked about. That way we can only send down patients that we know are safe to go down, and we can troubleshoot any patients that might need a little extra help. We can get that all set up and done so the patient can get done safely and efficiently. I hope you've enjoyed this presentation. I hope it's helpful. When you see me on the floor, you can ask me about it. I would love to discuss more with you about it. Take care.